Hello, my name is Ben and I'm the co-founder and director of training at Real Response here in Sydney. I'm also a paramedic with over 12 years of pre-hospital experience. Today, what I'm going to be speaking to you about is something that you should never do, ever, under any circumstances. Unless you absolutely have to and there's no other option. This is a situation where you have used an EPIPEN on somebody in anaphylaxis. That person then has persistent anaphylaxis, who's symptomatic, they can't breathe properly, their blood pressure is dropping, and they're dying. And you need to do something. There's no EPIPEN, there's no ambulance coming, you're in a remote, low resource or steer setting where you have no other option. There is a way you can actually access an additional 3 doses from this EPIPEN. If you were to do this, you should do this with the consult of a doctor via phone or internet, etc. Try to make sure you've spoken with somebody with a higher clinical level than yourself to make sure they've given you the authority to try and do this. If you absolutely can't get onto somebody, then it's your decision to decide what you're actually going to do, whether you're going to do this or not. Again, this is an absolute last resort. It goes against every guideline, every recommendation, every safety principle that at least I've ever learned in medical care. However, it is something that could save a life in that last resort. So what I'm going to show you is how to do this actually safely. So I've got my EpiPen, I've got a couple of syringes, a drawing up needle and sharps needle. I've also got a hacksaw blade. Very easily accessible. You can cut these open with pocket knives and other things, which I've done many times before. However, I find a hacksaw blade is the best way to do it safely. So you can see in between here, there's a bit of exposed clear plastic, and that's where you want to cut, just in there. So we're going to take the hacksaw blade, and we've got to be really careful. We've got to cut through there. Hacksaw blade can sometimes snap, so be careful. And cut about halfway through. Move it a bit further over, and we're going to cut a little bit further. We want to cut until there's about an inch left, until that's happening. And you can see the exposure of the black spring. It's under a lot of tension, we need to be quite careful. On the other side, you can see there's about an inch left. Now I want to snap it open gently and carefully to make sure the spring doesn't snap in my face or anyone else's. See the spring there? And I'm gently going to pull this out. Like that. Take the mechanism out. This is what's under high tension that causes the initial auto-injector to work. And take this out. Now you can see that needle's exposed. You need to be really, really, really careful here. Try and pull that back over. Gently. Very, very, very carefully. Ideally with something else, because I really don't want to be touching that exposed edge. If I can. If you can't, you can't. Look at how much adrenaline is left in there. Quite a lot. This adrenaline is 1 in 1,000. And if you actually draw this up, there's actually 1.5 mils left in there. That's 1.5 milligrams of adrenaline. In ambulance practice, we generally give 500 micrograms intramuscularly to somebody experiencing anaphylaxis. So there's 3 additional doses of adrenaline there at 500 mics each, or 0.5 mils. So you've got 3 options. First option to use this is to actually pull this plunger off, connect up a drawing up needle like this, pull this plunger off, draw up that medication into a syringe. You would have 1.5 mils in there, attach a sharps, and then you'd administer, ideally, as if you're a first aider, you would administer 0.3 mils, which is equivalent of 300 micrograms, which is the dosage of this EpiPen, every 5 to 10 minutes as symptoms dictate. Or if you're an ALS provider, it would be 0.5 mils or 500 micrograms or whatever clinical practice you have, or have been guided by by the consult that you're ideally being able to do before even starting in this practice. However, we're talking about a situation where you don't have access to any advanced medical care. This is an absolute last resort. You're in a very remote or low resource setting. So the likelihood that you're going to have access to needles, drawing up needles, syringes, etc. is probably low, possible, probably low. This is still your best bet. It minimizes the chance of needle stick injury. It minimizes the chance of infection in the patient. But it's still obviously not ideal whatsoever. In reality, as I've mentioned, you're probably not going to have access to that. So how do we actually use this to administer those additional 3 doses? You can see there's a plastic barrier here that prevents this plunger from going any further. So what happens when the EpiPen's activated, the tension in the spring releases, plows that plunger forward, pushing approximately, well, exactly 0.3 mils or 300 micrograms of adrenaline or epinephrine into the person's upper thigh, into their muscle, which then goes into their system and hopefully starts reversing the impacts of that anaphylactic reaction. We can't do this. So what we need to do, and again, you can still see that needles popping out, and I'm going to be really careful with this because I really don't want a needle stick injury. I'm just going to loosen that very, very softly, like that, by twisting it, so that's covered and somewhat protecting me, although not completely. So what I'm going to do is I'm going to hold it upside down and pull this off. You do lose a little bit. Hold it like this. Okay. Ideally, you can get somebody else to hold this for you. You might see. There we go. A trusty Sharps container's holding it for me. I've done hand hygiene, try and keep my hands as sterile as possible because I'm introducing obviously bacteria and pathogens by touching this. I then pull the cap off and I put the plunger back on this side. Give that a wipe with a bit of an alcohol wipe if I have. I then take this part, and this is a part that you need to make sure you don't lose, because if you just push this in, you're going to lose a lot of adrenaline. So you've got to gently push this over, make a very small seal, tip it upside down. There we go. We've managed to save nearly all the adrenaline. I'm going to push it up. There we go. And we're good. You now have approximately 3 doses left inside here. So what you need to do is you need to take this needle, go into the upper thigh, ideally bare exposed skin, approximate what a third would look like, and go, that's about a third. Wait 5 to 10 minutes to see if symptoms improve or not. If they don't improve, ideally you can then give a second dose. Then go another one, that's about half of this. Wait another 5 minutes at least to see if that person's improved. If again, still no improvement, and again, ideally throughout this whole process, you're consulting with a medical practitioner to give you advice on what you should be doing, then there's 1 more dose that you can go in. Obviously, you're reusing that needle 3 times, which you should never do, but we're talking about last resort, when there's absolutely no other option, and this person will die unless you take some sort of action. Then, with this, we need to dispose of that properly to make sure you don't get yourself any form of needle stick injury. That person you need to transport to hospital. We're concerned, obviously, for the anaphylaxis, but then also there's a potential infection risk because we haven't been very hygienic with the way we've injected that person with that adrenaline and epinephrine. Thank you for watching the video. I stress this is an absolute last resort. It's something you should never do unless you have no other option. And if you do have to do this, you should try and consult with a doctor or other medical professional and do it in the safest way, most responsible way possible. I hope you learned something today. Please follow our channel, enjoy our other videos, and have a great day.